I'm Hattie Llewellyn-Davis and I chair Bucks Healthcare. And it's my job just to do a very brief welcome to you all today. Let me begin just with the housekeeping bits, otherwise I'll forget them. We aren't expecting any fire drills. Should the fire alarms go off, follow the little green men that are around the place. That's the most important thing. There are toilets all over the site. The nearest to here are just out there. So, this is our second joint annual general meeting between Bucks Clinical Commissioning Group and the Trust. And we do them together now because we believe that our futures are linked to each other and that our triumphs are their triumphs and vice versa, of course. Their triumphs are our triumphs. So for us, it's really important to recognise that partnership and to do these events together. Over the last 12 months, we have continued to make good progress on the quality journey that both of us have set out to achieve. You will mostly, I'm sure, all know that following the visit by the CQC earlier this year, we now are rated as good, and indeed we are rated as outstanding for caring and for our end-of-life care. We're incredibly lucky across the health service to have incredibly skilled professionals who deliver outstanding care. For us, it's particularly outstanding and very high quality for cancer, stroke, colorectal surgery, spinal injuries, and family nurse partnerships, where we deliver incredibly good partnerships. We're also really proud that we're seen as a national exemplar for work being done by our medical examiners, where we learn from the death of each individual patient who dies within the service, and that helps to improve services in massive ways. We continue to face enormous pressure, and we need to acknowledge that and recognise that. We know that that's both an ever-increasing demand on our services, but also a continued financial pressure. Over the next 10 years, we expect the population of Bucks to have increased by 40,000 people. And that's going to be a very significant proportion of whom will be children and older people, so very few people of working age. And particularly, those two groups are very high users, of course, of health services and care services across the county. So all building and increasing the pressure. Working together with our partners across the health and social care system, we are absolutely committed to ensuring we address those challenges and that we ensure that the people of Buckinghamshire are able to lead happy and healthy lives and to receive outstanding care where and when they need it. I couldn't do any of this presentation today without acknowledging the achievement of our staff and our volunteers across both organisations who work so hard to ensure that we provide the best outcomes and experience. So on behalf of both the Bucks Healthcare and the CCG board, our patients and our local communities, I'd like to thank every one of you in this room and therefore through you to the whole of the two organisations. Over the next 20 minutes you're going to hear a little bit about what we've been doing over the last year. We're not going to take too long, it's a gorgeous day out there, so we're going to get you back out into the beautiful weather as soon as we can do. There will, at the end of it, be a chance for you to ask questions. When you go back out, the stalls are not all just in this space here. Head round to the left and you'll see more stalls and a police van as well, who, as I understand it, are not intending to arrest anyone today. If you go to the welcome desk in this car park out here, you'll also find access to book on tours, where last year the really exciting tour was the mortuary. So anyone who wants to go to the mortuary, book on a tour. That's me done. I'm going to now move over to a very quick video about our achievements collectively across the two organisations over the last year.
So I'm Gary Henage. I'm the Chief Finance Officer for Buckinghamshire Clinical Commissioning Group, otherwise known as the CCG. So I'm just here to give you a very brief overview of the annual report and accounts for the last financial year. But before I do that, I just thought it would be useful to explain what the CCG does. So the CCG is responsible for commissioning healthcare services, and often people ask us, what does commissioning mean? And people think commissioning is just about buying services, but it's much more than that. It's about how we collectively plan and prioritise our services to make sure we offer the best and highest quality healthcare services for our local population and patients. So in terms of commissioning then, what do we actually commission? So the main services within commissioning our healthcare services are our hospital services. So that includes emergency care and planned care. We also commission mental health services, and our biggest, our final one is general practice, otherwise known as primary care. And just to give some context and some numbers, our allocation, which is also known as income, our income for last year was £717 million. So let's get on to the numbers for last year. So the CCG ended the year with a surplus of £95,000. So what does surplus mean? So that just basically means that we spent less than our income or less than our allocation. And that was supported through £15.5 million of Commissioner Sustainability Fund, which is a national fund set up by NHS England to help CCGs get back to a financially sustainable position. And I'm pleased to say that resulted in all areas of our accounts being unqualified for the year end. That concludes my presentation. I'd like to hand over to Barry, who's going to talk through the trust position.
Thank you, Gary. My name is Barry Jenkins. I'm delighted to be the new Finance Director for Buckinghamshire Healthcare Trust. You can obviously see that for Finance Directors in this patch, you need to have rhyming names. The next chap to come along will be Larry. I've been told to keep this to less than an hour, so if you can just all bear with me, that would be helpful. So into the numbers on the next slide, we reported a deficit at the Trust of 31 million. That means effectively we spent £31 million more than the income we received. As an organisation that turns over in excess of £400 million, we spent a lot of money on meeting the healthcare needs of the population, but the income we received wasn't enough to cover the costs. I guess positively, we remained within our external financing limit and our capital resourcing limit, and we did improve on our payment of invoices, which were all positive things. In terms of our audit opinion, we received an unqualified opinion on the accounts, although we did have an issue in regards to value for money, and that was because of the deficit that I just mentioned there. And that concludes my finance review for the Trust. The intention is to work in making this better with the CCG over the next number of years. So that's the plan. In terms of the charitable fund, we received income of £1 million. Our expenditure was in the region of £2 million across a range of different areas, including patient welfare, staff welfare, and training and education. And that's as much as I'll say just now. And I'll hand over to our Chief Executive, Neil MacDonald. Thank you.
Thanks, Barry. So rule number one of presenting is always make sure you follow the accountants, because you're likely to have something slightly more interesting to talk about. So good morning, everybody. You know me, I'm Neil MacDonald, the Chief Exec of this organisation. I'm sort of going to set out, I guess, a few strategic priorities and what our plans are going forward. I guess in doing so, it's always, I would find it helpful to say a couple of thank yous and do some reflections, really, because that sort of informs where we go forward from here. I guess the first sort of thank you I would say is, as Hattie has very rightly said at the outset, is to thank all our staff, all our volunteers and all our patients who help us run this large organisation. It's quite difficult sometimes to shove a load of numbers up in front of you and give some context to what those numbers mean. So those numbers behind me show a 6.5% increase in demand for our services last year, which collectively we've managed with flat resources. And we've managed those remarkably with all those things that you've seen. So what do they mean? Well, they mean about 6,500 more operations that we've done last year compared with the year before. They mean about 9,000 more patients seen within 4 hours in A&E. They mean about 12,000 more people seen by our community teams in their own home. So this is a significant pressure, and one of the great privileges of doing this job is to be constantly humbled by the amazing things that our staff do in keeping the people safe, because behind those numbers, they are your relatives, your family, and we have an enormous responsibility for keeping the people of this great county safe and well. So I can't thank you all enough. The second group of people I'd like to thank is our partners, really. So we can't run the services that we do as an island. We do so with fantastic support from our charities, from the local authority, and from our other health partners. The great thing about working in this county is there is unparalleled, really, strength of relationships here. We're very lucky to work with a set of organisations and people who share the same values, the same ethos, and the same goals to achieve great things for this county and delivering the triple aim, really, of improving people's health outcomes, let them having a great experience of their care, and also being custodians of the taxpayers' money. And then coming together as part of an integrated care partnership, we have 4 goals that we've set out to do over the coming 2 years. So one is to ensure that in our most deprived areas that children have the healthiest start to life, and we can set them off in their healthcare journey with the best possible start. Secondly, to ensure that we help the sustainability of primary care, so GP services, through closer integration with our community services. Thirdly, that we work incredibly hard with our partners in the local authority to make sure that where possible we can get people back to their own home and independent living and reduce the burden of long-term care. And lastly, that we work with our partners to ensure that people with mental health needs are treated with exactly the same parity of esteem as those with physical health needs, and to reduce the number of people who have to go out of the county to seek care. And then the final group of people I'd like to sort of thank and reflect on are really these lovely people behind me. So this is sort of my team and the people who run this organisation, and I've done so really in the last year with in the face of some significant financial challenges, through a fairly challenging winter, and also organising and managing a CQC inspection, which is for those of you who have been part of that process, is not an easy and certainly not a time-limited operation. And they've done so with skill, and they've done so with a lot of hard work and a little bit of humour as well. So I'd like to thank them. And of course, they, with me, with members of the board, are responsible for setting the strategic priorities of this organisation going forward. And we've got 3 of those, really, that we're going to be focusing on. So one is the culture of this organisation. It is not a coincidence that the CQC rated this organisation as outstanding for caring. That is our foremost goal, to create people who live the values that we want to see. Healthcare, despite advances in digital technology, robotics, all the technological changes that we're seeing, is fundamentally a people business. And it's really important to us that we have great people who can live those. That we have people who reflect the communities that we serve, who learn from experience, who are good custodians of taxpayers' money, and who really involve the public and patients in designing services. Secondly is our workforce. We operate in an environment where across the country 1 in 9 clinical posts in the health service is vacant, because quite frankly we don't have enough skilled professionals to do the job that we need them to do in light of such demand. So a lot of energy and effort in making sure that we are developing, retaining and bringing in the best people to work in this organisation, that we are recognising those groups within our staffing workforce who are at a disadvantage, that we have excellent training and education facilities, and I'm really pleased that we are training nurses in this county for the first time ever from this month, and that we are really understanding how we can use everybody's skill sets, everybody's professions to form those teams to look after our patients. And then our last priority is around how we're tackling some of the structural inequalities that exist in this county and the variation that can exist. So there are some fairly stark numbers around the life expectancy or the years in good health or the children's readiness for schools between our most deprived areas and our most affluent areas. And it's really important that we're working together with our partners to tackle some of those things, whilst also making sure that every person who comes into contact with our services experiences the same high quality standards that we expect to give every time. And that means investment in our IT infrastructure and also means investment in our estate. So I will pause there. I think I've got a slot now to open it up for questions from the audience, and I will do my usual thing of inviting questions, and if they're too difficult, handing over to my team to answer. And I've got a roving microphone assistant over there. Okay, done. You're very, very well behaved. The plea to get out into the sunshine was well heard. Raj.
Thank you, Neil. For those of you that I've not met before, my name's Raj Bajwa. I'm a local GP, but I also have the honour of being the chair of Buckinghamshire CCG. And I want to just give a closing address. But before I do that, just a couple of bits of recognition to the comms team who've helped put this session together. Thank you very much. And for all the staff that's helped organise the second AGM, which really is a kind of engaging community-based event. I just want to give thanks to them. And the second bit of recognition is about the quality of care that's provided to the people in Buckinghamshire. We aren't allocated a lot of money because we're seen generally as a healthy, relatively wealthy part of the country, and the way that financing works means that you get less funding, and we get substantially less funding than probably our population requires or deserves, and yet we still manage to deliver superb levels of healthcare, which are often certainly regional leading or national leading in many instances. And I just wanted to pause for a minute and just share that with you, that almost the healthcare that we've grown to expect in Buckinghamshire does not come easy. It comes with huge amounts of skill, huge amounts of organisation, and huge amounts of attention. And I think one of the traits of Buckinghamshire is we don't celebrate our successes as frequently and as loudly as we might. So I just wanted to say that. I spoke at this AGM 12 months ago, and at the time we were in the midst of celebrating the 70th birthday of the NHS. And quite rightly, we reflected on the things that were unique and precious about this thing that we call the NHS. And many people take that for granted. In January of this year, the NHS published a new document called the Long-Term Plan. And in its own words, the idea behind the plan was to future-proof the NHS and to future-proof it for the decade ahead. And so the hope is we can meet together in 2028 and celebrate the 80th anniversary with the same sense of pride in the NHS service that many of us work in. In launching the long-term plan, the NHS chief executive said he wanted an NHS that worked for our parents' generation and for our children's generation. And he said that with good reason. There are some factors that went into that. In the next 5 years, 1 million people in the UK are going to retire. Our population is ageing, and we will never have had a greater proportion of our population aged over 65 or aged over 80. That is going to present challenges. At the other end of the life spectrum, for every 3 girls that are born in 2019, 1 of them will live to the age of 100. And that, again, presents challenges. Our NHS has got to adapt to this kind of evolution in the population we look after. And unless it does, it won't succeed. Therefore, in its 136 pages, hands up who's read all 136? Ooh. The plan contains some key initiatives, and I'm just going to give you the highlights. It wants to create better support for older people in their homes. It wants to better integrate community services. It wants more resilient, better resource general practice, with primary and community care coming together to form primary care networks in partnership with local voluntary services and patient groups. And that's a key theme that you will hear more about over the next few years. It wants to halve maternity-related deaths. And I think a key target that Neil alluded to, it wants to tackle health inequalities. And I think that's a real issue for us, where we've got some of the best health outcomes in certain parts of our population and very poor outcomes in much more deprived populations. And that is something that we must all work together to address. Now, the good news is that locally, we had anticipated much of what was in the long-term plan. And we've been working together for a number of years. And we feel that the publishing of the plan will strengthen our ability to deliver things that we've wanted for a while. However, in the document, the Chief Executive was quite keen to stress that this future-proofed NHS would only be possible with the ongoing contribution in every role and at every level of the superb 1.3 million people that work in the NHS. And for us in Buckinghamshire, that's more than 6,000 individuals, some of whom are here in the auditorium. And on behalf of the Trust and the CCG, I want to echo the comments that almost everyone's made to thank those individuals who work tirelessly every single day to look after the people of Buckinghamshire. Perhaps we could give them a round of applause. However, we need more of these people, and we're very proud to have been involved in the national recruitment campaign, which is seeking to attract more nurses to work with us locally. I want to end the AGM by sharing with you a video of some of the adverts of that recruitment campaign. All the staff that you will see have been working either at Stoke Mandeville or Wickham Hospitals or out in the community. Thank you very much.